The Infirmary Cancer Care Center, we're so happy to have y'all here. It's great to have an option here in Fairhope. The facility is gorgeous. It's amazing. And it's amazing how the staff puts everybody at ease to go through such a thing such as cancer, and just to be able to put them where, not carefree, but just as calming as it can be, and just make the experience as great as possible. At this time, I'd like to turn it over to the President and CEO of Infirmary Health, Martin Nix. Martin?
Thanks, Frank. Appreciate it. And we're excited about this. This is a facility set dormant for a long, long time. We haven't had radiation oncology services for this community in quite a few years. So when we acquired the building and turned it over to Susan Boudreau and her team to try to reinstitute cancer services across our system, not just in Fairhope, they did an excellent job with this, and then they picked out some equipment with the help of certainly Dr. Russell and Dr. Gilbert and Dr. Asher, and we're really, really excited about what we're bringing to people in this community. People don't want to travel far when they don't want to get away from their families, and we hear that, and we've seen that, and we get a lot of feedback from people that have been through treatment and had good experiences and bad experiences, and they want to be at home, they want to be close to home, and those that are close to this facility know how much it means to them. So I want to thank all of you for coming out. I certainly want to thank our staff and the support of our physicians here, Orman for his job in running the hospital and those here. And I'd like to turn it over to Barry Sanders, who wants to say a few things about the clinic and the staff here. So, Barry?
Well, thank you, Mark, and I'll be very brief. This clinic, Infirmary Medical Clinics, has IMC Radiation Oncology. We have an office in Mobile and this one now, and we're excited about this one here at Thomas Cancer Care, and we're looking forward to a great relationship with the community over here. We've had a long-time relationship with Dr. Russell and Dr. Gilbert we've known for years, and Dr. Asher. We have some of the best radiation oncology services available anywhere right here in this Fairhope community, and it's very exciting to be led by a great group of physicians that are supremely qualified to provide cancer services. So my wife is a former patient of Dr. Russell's, and some other oncology providers over here. I'm thinking about her today with my pink tie, and she's doing great thanks to the outstanding care that's available. But I want to call this Susan Boudreau has really been behind all this. She is the VP in charge of our cancer services line, and she has helped develop all this and picked out this fantastic equipment with the help of the physicians, and we have the latest and greatest equipment available right here at home. And so Susan's really worked hard to make this success, and she just leads a great effort. And Ronnie Hawthorne is with her all the time, getting the work done. Ronnie's the director over this, and Greg Shoemaker is our Infirmary Medical Clinic director over here, who helps with the business operations. But I'm going to let Ronnie introduce the staff to you.
All right. Just wanted to give you an idea of what Thomas Cancer Care looks like, and be sure that we recognize the staff because they're such an integral part in what we'll be doing going forward. First, I want to recognize Matt Williams. He's one of our physicists. We have Dana Bullard. She mans the phones not only for Thomas but also for Mobile Infirmary. So when you call that Infirmary Cancer Care number, she's the person you'll be talking to. We got Daryl Watkins. He's one of our dosimetrists, one of two. They work remotely from Mobile, but it's like they're right here so that the physicians have easy access to them for the treatment planning pieces. We have Kristen Duncan and Mike Rao, who are back there. You'll be seeing them very soon. They'll be doing the tours, kind of explaining the technology and the unit we're using, and how great the accuracy and how quick we can deliver those treatments to the patients. We got Maisie Patrick. Where are you at, Maisie? There she is. She's one of our nurses here. We also have Allison LeBlanc, who is one of our cancer navigators. And then last but certainly not least is Karen. Where are you at? There she is. She's with our tumor registry.
Can I just add something briefly? I want to recognize one of our patients who's worked with us. You might recognize her also. She's been on the cover of Best Magazine. Beautiful Rebecca Cunningham. Thank you for coming today.
Of course, thanks for having me.
She sort of led our initial effort to get back into the community with our cancer service, and we're really honored by her presence today. Thank you for coming.
So maybe we'll let hear from Dr. Russell now and talk a little bit about coming home to the infirmary and coming home to Fairhope.
That's right. Well, I officially retired the 31st of May, and I had 15 hours of retirement.
I was hoping that didn't happen this morning.
And I moved back to the Mobile Infirmary where I was based for 27 years. And part of that experience was over here with Bill Getter, Brett Walker, some of you know him. The center that Bill practiced out of most recently was part where I had a quarter of that. So I had consults and follow-ups over here. And your point is well taken. It was a real chore back in those days for all the folks to move from Baldwin County to Mobile. The only saving grace is it didn't have half the population that it has now. So since I had been back over here, I would say at least half a dozen patients have told me, I only live 2 minutes from here, I'll be right in. And they come right in, get whatever's needed, and they're gone. And they just are so thankful they don't have to fight the Bayway and get into the Mobile traffic, which is very intimidating if you live on this side of the Bay and you're 80 years of age. It's intimidating for all of us, but especially the elderly people. I would like to take a moment and just amplify what Ronnie has said. This is a team effort. So the doctor is maybe at the front of the ship, so to speak, for a little bit, but then there's a handoff to all of these highly qualified individuals. The team that has been assembled by Ms. Boudreau and Mr. Hawthorne is absolutely wonderful. I couldn't have chosen them better myself if it was totally up to me. The only condition I asked Mr. Nix to abide by is that I was not going to be chairman of the department. I'm going to be working and seeing my patients on a day-to-day basis, and I really, that's my love. Second is clinical trials, and someday we may be moving in that direction as well. But I want to thank all of you for coming. This is my coming home back over here. 25 years ago, I left to go up to Daphne and then also cover Mobile. So this is just wonderful, and it has expanded. The whole campus is radically different. Kudos to everybody involved. We'll be working together as a team, all of us. The Cancer Society also helps us, and we look forward to networking with them. We have a Us Too group coming in, I understand. We have a head and neck group, support group. We're doing great things here that may not be visible right now, but stay tuned. Thank you.
Great.
Just a few comments about, you know, we're able to do things like this with the support of great community leaders that serve on our board of directors. And we have 17 members, 16 other than me that serve on the Infirmary Health System Board of Directors. Half of those live in Baldwin County, and the other half live in Mobile, so we are fairly represented, so to speak. It seems like yesterday, but this month will be the 11th anniversary of Infirmary Health System and Thomas Hospital coming together, and it seems just like that just happened yesterday. But if you look at what has been invested and what's changed, and I would say that Thomas Hospital has never been stronger financially. It's never provided more services. It's never had better leadership and better quality of employees and physicians on the medical staff. And we continue to grow, and we need to continue to grow with the community. I said this last night when we had a small celebration out front. We have invested over $75 million in Thomas Hospital in those 11 years. And that is just on the front end. We have $20 million worth of investment coming this year in the form of the new freestanding emergency department, which will break ground on either later in October or early November, and we'll have an opportunity to have another ribbon cutting and some more food, I guess. Hopefully a bit cooler than when we did the one in Saraland. But we are at a historic time, and we are at a very proud time to be not only associated with the community, but with this health system that is doing so much to try to deliver so much care closer to home, and we continue to try to grow as the population grows. We have done a lot of things on this campus, some of them that are very obvious, like the North Tower, and some that are less obvious right now, but the birth center that's underway right now, $9.5 million investment, thanks to the community that helped raise $6 million of that with the help of Kathy Ball and the foundation. And then we have others that don't look so obvious right now, where we bought the Self building over here, and we're still working on future plans for that. And we realize parking is an issue here, and we're going to be addressing all of that. So, you know, I said this last night, we are just custodians for a period of time. You know, this hospital is, I think, 57 years old now, and the Infirmary Health System is, you know, 107 years old now. And hopefully 100 years from now, we'll be looking back at what we helped build the foundation for and lead the seed for where we're going. And one last group, we couldn't do it without community support, certainly governmental leadership support. We're getting a lot of that from Fairhope Single Tax Colony, from the Fairhope Chamber, Frank, appreciate that, and from the City Council and the Mayor, and those of other cities and City Council members in Baldwin County. So thank you all for being here, and thank you for making it easy on me to be proud of what we do, because you care for people every day that we're trying to improve their lives. So, Frank, you want to add something?
I don't know
Finish
how
up
I add
with?
anything on top of that. Bart, thank you, Barry, all of you, and by the way, Barry Sanders. I mean, that name is not forgettable right there. But everything, this is wonderful. Don't forget, there's wonderful food here. Also, the new website has been released over here too. You'll be able to see that, and when we get back in for ribbon cutting as well, please make sure you take a tour and see everything this wonderful facility has to offer. Now, at this time, it is the first day of fall, and of course, we have wonderful fall weather today. So we're going to take this picture outside. So if you will, everybody, we would love to have as many of the staff and everybody, the ambassadors and other chamber members have come for this, and everybody from the community to come outside. We got plenty of room out there for the picture, and we'll step outside now and get lined up for it. So,
Thank you.
all right, thank you. Yes, sir.